The case for universal healthcare. As modern science has improved, America has become more and more able to provide higher quality healthcare to its citizens. But the private insurance model set up by American capitalist ideology has barred many people from obtaining necessary medical care that should be easily available. The discussion over universal healthcare has reduced itself to the age-old dialectical tension of socialism versus absolute free market capitalism. Two things that will never exist independently in America. Universal healthcare, covering basic health and other preventative measures, should be available and accessible to everyone in America. To begin with, the current system is fundamentally broken and in dire need of change. Also, it can be easily argued that universal basic healthcare is supported by the Constitution, the document that many religiously follow. Research shows that universal healthcare could be fiscally feasible without drowning middle and lower class America in expenses. The current system involving employer-subsidized and private healthcare is fundamentally broken. In an article from a well-respected source, The Atlantic, writer Olga Kazan details the failings of the U.S. system, saying almost 10% of the American population, over 27 million people, aren't insured. And it's well known in scientific literature that having insurance lowers mortality rates. The private insurance system we currently have does not adequately serve a significant portion of the American population. Oftentimes, it's the population needing healthcare the most. Kazan continues in saying that we waste a lot of money on administration, money that could be used to actually provide the care Americans actually need. This system is disorganized and inefficient, side effects of free market capitalism, and two things no system wants to be. Capitalism doesn't solve everything, especially when it comes to people's safety and lives. It could also be very reasonably argued that universal healthcare is supported by the founding fathers of the United States. In the Constitution, it states that the people of the United States strive to promote the general welfare in order to form a more perfect union. Nothing screams promote the general welfare more than healthcare for its citizens. Giving basic healthcare to people who lack insurance will make that group of people more well generally and help keep the whole public of America healthier. This would lead to more longevity and happiness. Happy, healthy people can lead to many benefits to a society as a whole, including more spending or an improved economy. A country like America, the oft self-proclaimed greatest country in the world and defender of democracy, surely should at least consider a form of universal healthcare, given that it's widely known that the majority of Americans support the idea, according to healthaffairs.org. Additionally, a New York Times article from Matt Brunig details how the middle class of America already pays around 40% of their income towards taxes and insurance premiums, one of the higher rates in the world. If we can reconfigure the system, eliminating insurance premiums and putting all that money towards universal healthcare, the cost would not be all that different. Detractors to universal healthcare commonly argue that free healthcare drastically increases the cost of healthcare, asking where they will get the money from and saying that healthcare already costs too much in the first place. But an article from Chase Matter in the American Conservative details how a single-payer healthcare system actually can save the country money, saying that even as America spends 18% of our GDP on health expenses, countries like Canada and Germany pay almost half that. It also says that private insurers suck up a lot of money without adding any value. We also have the added benefit of being able to look at the rest of the world and see what has worked and hasn't worked in their various universal healthcare models. We can take the best characteristics from each one and fit it to the United States. We all know deep down, no matter our political biases or perceptions, that people deserve health. There's no reason for America to be falling behind the rest of the world in terms of caring for its citizens. We've been the pinnacle of science and innovation for a long time, but actually utilizing it has proven more difficult than it should be. The cost of universal healthcare isn't as drastic as it seems, as demonstrated by all the other developed countries' systems. And if America wants to live up to its ideals and become the America it once thought it was, but it hasn't been yet, we need to stop lagging behind our peers and implement a form of single-payer healthcare.